Welcome to this edition of the Lucid Quest Women's Health Strategic Roundup, covering developments from June 24 through August 4, 2026. The defining story of this reporting period was the growing convergence of policy reform, regulatory action, healthcare delivery innovation, and precision medicine around a common objective: closing long-standing gaps in women's health. What makes this period notable is not any single approval or policy announcement, but the emergence of a more coordinated ecosystem for women's health innovation. The market increasingly appears to be moving beyond isolated therapeutic advances toward a model that combines stronger research infrastructure, expanded access pathways, and more personalized treatment strategies. Several developments pointed to this trend, with 4 themes standing out. The first theme was the growing institutional momentum behind women's health policy and regulatory reform. In both the United States and Europe, policymakers and regulators advanced initiatives designed to address structural barriers that have historically limited innovation. The proposed U.S. national strategy to close the women's health gap and the European Medicines Agency's new women's health initiatives both focus on foundational issues, such as research funding, evidence generation, regulatory support, and data infrastructure. Why does this matter? Because future innovation depends not only on scientific breakthroughs, but also on the systems that enable those breakthroughs to be developed, evaluated, and adopted. A more supportive policy environment could improve development economics across areas that have traditionally received limited investment. The key uncertainty is execution. Funding commitments, implementation timelines, and measurable impacts on care and innovation remain important watchpoints. A second major theme was the expansion of access in menopause and reproductive health. Scotland's recommendation of Veozah broadened access to a non-hormonal treatment option for menopausal vasomotor symptoms, while Ireland's proposed pharmacy-based contraception renewal model reflects a shift toward more community-centered care delivery. For stakeholders, these developments suggest that healthcare systems are increasingly treating access as a strategic objective, rather than simply a consequence of new product launches. This could create opportunities for treatment adoption, patient engagement, and service innovation. However, long-term success will depend on reimbursement, clinician acceptance, patient uptake, and the ability of these new models to demonstrate meaningful value. The third theme was the continued rise of biomarker-selected immunotherapy in gynecologic cancers. Positive phase 3 results for pembrolizumab in mismatch repair-deficient endometrial cancer and expanded access in cervical cancer both reinforce the growing role of molecular profiling and earlier immunotherapy intervention. The strategic significance is clear. Competitive advantage is becoming increasingly linked to biomarker strategy, patient selection, and evidence generation in defined populations. At the same time, important questions remain around overall survival outcomes, reimbursement decisions, and how treatment sequencing will evolve as additional data emerge. The final theme involved earlier detection of resistance and earlier intervention in breast cancer. Developments surrounding camizestrant and ctDNA-guided ESR1 mutation monitoring, alongside progress toward earlier use of Enhertu-based regimens, highlight a competitive shift toward identifying disease evolution before clinical progression occurs. This suggests that future leadership may depend not only on therapeutic performance, but also on the ability to integrate diagnostics, monitoring, and treatment decision-making into routine care. Adoption will depend on testing infrastructure, reimbursement, workflow integration, and confirmation of long-term clinical benefit. Looking ahead, we will be watching the progress of U.S. women's health funding and legislative discussions, outcomes from the EMA's upcoming women's health initiatives, regulatory pathways emerging from the Keynote C93 data, adoption of ctDNA and ESR1 testing strategies, and the commercial trajectory of Enhertu plus pertuzumab in Europe. The key takeaway is that women's health is becoming a more strategically significant and increasingly coordinated area of healthcare investment. While precision oncology remains the most visible source of competitive change, the larger story is the strengthening infrastructure surrounding women's health innovation, suggesting that future market evolution may be shaped as much by improved systems, evidence, and access as by new therapies themselves. Thank you for joining this edition of the Lucid Quest Strategic Roundup. For more healthcare market intelligence and strategic analysis, visit www.loqventures.com.